Hello, my name is Kendra Inglis, and I chose tuberculosis as my illness. It is an illness that mainly affects the lungs. The germs that cause tuberculosis are a type of bacteria. Tuberculosis can be spread when a person with the illness coughs, sneezes, or sings. This can also put tiny droplets with the germs in the air, and another person can breathe the droplets and the germs enter the lungs. Tuberculosis spreads easily where people are gathered in large groups or people that live in crowded conditions. People with HIV, AIDS, and other people with weakened immune systems could use antibiotics to treat tuberculosis, but some forms of the bacteria no longer respond to the treatments. Symptoms would be germs survive and multiply in the lungs. It is called a TB infection. A TB infection can be in one of 3 stages. Symptoms are different in each stage. Primarily TB infection. Immune system cells can find and capture the germs. The immune system may completely destroy the germs, but some captured germs may still survive and multiply. A lot of people don't have symptoms during a primarily infection. Some people may get flu-like symptoms such as low fever, tiredness, and cough. A person with a TB infection cannot pass the disease to other people. A person taking medication to treat active TB disease usually can't pass the disease after 2 to 3 weeks of treatment. Some forms of TB bacteria have become drug resistant. This means that medications that used to cure the disease no longer works. This happens because of natural occurring genetic changes in bacteria. A random genetic change in bacterium might give it some quality that makes it more likely to survive the attack of an antibiotic. If it does survive, then it can multiply. When antibiotic medications aren't used correctly, or medications fail to clear out all the bacteria for other reasons, and the conditions are ideal for more resistant versions of the bacteria to take hold and multiply. If these bacteria are passed on to other people, a new drug-resistant strain can grow over time. Problems can lead to such drug-resistant strains of bacteria include the following. People that don't follow the directions for taking the medication or stop taking it completely. They weren't prescribed the right treatment plan. Medications were not available. The medications were of poor quality and the body didn't absorb the medications as expected. Risk factors. Anyone can get tuberculosis, but certain factors increase the risk of the infection becoming active TB disease. Age 65 and age 15 to 25, people in this age group have increased risk of developing more severe active TB disease in the lungs. As of 65 and older, the immune system weakens during them getting older. Older adults have a greater risk of active TB disease. Also, the disease may be more difficult to treat.